You are correct. So here, let me give you two lectures, and then we'll go over a Jeopardy sort of quiz. Okay. So the first lecture is on. You guys can see this, right?
Yes.
First lecture is on carbon monoxide. Okay. The reason I think you should know about carbon monoxide is because it kills people. It kills people, and it's a respiratory disease. Actually, carbon monoxide is the #1 gas that kills people every year. Okay? So, what is it? Well, it's a colorless, odorless, tasteless gas that is basically air pollution. It weighs less than air. It is released by inadequate combustion. Inadequate combustion. What are the effects of carbon monoxide? Well, it's in the air. It's in the air naturally. So when you breathe in, you not only breathe in oxygen, you also breathe in carbon monoxide. And the formula for carbon monoxide is CO. Okay? So not only does oxygen enter your blood, but also carbon monoxide enters your blood. When you use when you use oxygen, it's normal. In comes oxygen, out goes carbon dioxide. The problem is that carbon monoxide stays on to hemoglobin. It allows it to grasp onto hemoglobin. It combines to hemoglobin to form carboxyhemoglobin. And when it attaches more readily than oxygen does. It hinders the delivery of oxygen to the body, thereby giving you hypoxia. Some of the symptoms are based on how much carbon monoxide is in the air. You go from a small concentration that will give you headaches and dizziness to a more thriving headache, to more dizziness, to nausea, to convulsions, to more dizziness and unconsciousness after a few breaths. So it's important to have carbon monoxide detectors in your house because it is a product of inadequate combustion. And it usually occurs in the winter time in homes that don't have furnaces that are acting and doing their job correctly. Okay? But it's in the atmosphere. It's in the atmosphere. So if you look at the amount of carbon monoxide in homes, it's in all homes. Okay? But when you have a problem with your stoves or your furnaces, then it rises. As you can see here, it's exhaust from automobiles, exhaust from home wood fires, and exhaust from catalytic converters. That's what causes the majority of carbon monoxide in your atmosphere. It is more common to have carbon monoxide in the transportation arena, cars, buses, motorcycles. It's also in the industrial areas, and you can see the smokestacks here, okay? But it also is in residential areas because all residents, especially where up in north where we live, have furnaces. And if your furnace is not cleaned correctly, you'll have combustion that will produce more carbon monoxide. So what are the sources? Well, the sources are wood fires, furnaces, anybody that has an attached garage and keeps their vehicles running in that attached garage, wood fires, water heaters, indoor grilling. You should never grill indoors. It really produces a lot of carbon monoxide. Ranges, clothes dryers, and portable heaters. And these, look at these. Most of these portable heaters are electric, but some of them are run by diesel. So diesel is a problem in the formation of carbon monoxide as a byproduct. So what do you do if you suspect that there's carbon monoxide poisoning? Well, obviously you turn off your sources of heat. You take the victim out of the area and give them fresh air. You avoid possible sources of carbon monoxide. And obviously you call 911. Okay? So that's carbon monoxide. That's carbon monoxide. One other thing about carbon monoxide that is important is that, we talked about pulse oximetry, and pulse oximetry measures the percent of hemoglobin that is saturated with oxygen. But what if you throw in carbon monoxide? What happens to the pulse oximetry of a person who is poisoned by carbon monoxide? Does anybody know? Does it go up? Does it go down? Does it stay the same? Let me ask the question in a different way. Here's the question in a different way. 30% of your blood is now attacked by carbon monoxide. That means that 30% of your hemoglobin is saturated with carbon monoxide, leaving 70% of your hemoglobin to be saturated with oxygen. Does that affect your pulse oximetry? Anybody?
Yes.
Tell me how, Joe.
I'm not sure.
Any other comments?
Does it go up?
Okay, let me tell you what. It's not affected. It's not affected because what does pulse oximetry measure? It measures the percent of hemoglobin that is saturated with oxygen. It doesn't measure carbon monoxide. It only measures the saturation of hemoglobin. So if you only have 70% of hemoglobin that is attached to oxygen, it's still going to be 100% saturated. Does everybody understand what I just said?
Yeah.
Okay. The same thing happens with cyanide. Cyanide attaches to hemoglobin to make cyanomethemoglobin. Michael, you're out. Thanks, Michael. Okay, so cyanide attaches to hemoglobin to make cyanomethemoglobin. So you could be dead, or not dead, but dying from cyanide poisoning, and your pulse oximetry will be normal because it's only measuring oxyhemoglobin saturation. Does everyone understand that concept?
Yes.
Good. Any questions before we go on to lung disease?
Wait, so didn't you say it poisons the hemoglobin?
It does.
So it wouldn't show that? It wouldn't show like decreasing amounts of it, or because
No,
it's the
no,
saturation, right?
it does not show decreasing amounts. But if you draw blood on someone who you think has been poisoned by carbon monoxide, what you ask for is in the laboratory, you say, I need to get me a carboxyhemoglobin level. Your carboxyhemoglobin level, if you don't smoke, is less than 5. If you smoke, it can be as high as 10. But if I draw a carboxyhemoglobin on someone who I suspect has been poisoned by carbon monoxide and it comes back 25, I know I'm correct. Does that make sense, Rip? Does that make sense?
Yeah, it does. Thank you.
Okay, all right. Okay, let's talk about lung disease. Whoop. All right, lung disease. You're going to give us lectures on Monday on cardiovascular diseases, we're also going to give us group lectures on not Monday, Tuesday, and I thought I would at least talk about some common lung diseases, so you can understand what happens in these diseases. Okay, the big one is COPD. Chronic obstructive pulmonary disease. It is characterized by emphysema and bronchitis, chronic bronchitis. The key feature of this disease is that it is irreversible. It cannot be reversed. And the problem with COPD is not the ability to get air in, but the ability to get air out is decreased. That's a very important concept to understand. You cannot get all the air out. If you can't get all the air out, what goes up? Does oxygen go up or does carbon dioxide go up in your bloodstream?
Carbon dioxide.
Correct. This is a carbon dioxide disease, not an oxygen disease. It eventually is an oxygen disease because if you can't get all the air out, you can't get more oxygen in. So not only are they hypoxic, low in oxygen, they are hypercapnic, high in carbon dioxide. 80% of the cause of COPD is smoking. The word dyspnea, we talked about it before, means difficulty breathing, air hunger, labored breathing. You know, we didn't really talk too much about normal ventilation. Normal ventilation is effortless. You don't realize that you're breathing until something is wrong. Okay? So, what do you think these people look like that are trying to get the air out of their body? They have labored respiration. They purse their lips to try and get the air out. They exhale like this. They try to get the air out. They have frequent lung infections. They cough all the time. They develop hypoventilation. And when you get hypoventilation, not only are you low in oxygen, hypoxemia or hypoxia, but you also have a respiratory acidosis. Remember the formula, H2O plus CO2 equals H2CO3. People that have COPD have a higher amount of carbon dioxide in their body. So the water plus the CO2 that's now elevated will give you more carbonic acid. And that's called respiratory acidosis. When the partial pressure of carbon dioxide rises, that's known as respiratory acidosis. Emphysema, permanent enlargement of the alveoli, destruction of the alveolar walls, resulting in decreased lung elasticity. And that has three consequences. You now need your accessory muscles to breathe. You now need your intercostals. You now need both your external and internal intercostals to breathe, leading to exhaustion because you now are using energy to breathe. More energy than you would normally. The trapped air in your lungs causes hyperinflation. Your chest becomes bigger. Your diaphragm flattens. And your ventilation efficiency is reduced. You also have damaged pulmonary capillaries, leading to an enlarged right ventricle. Remember, the right ventricle is putting blood into the lungs. If you have emphysema, obviously you should quit smoking. There are people that have a genetic predisposition to emphysema, and that hereditary factor is known as alpha-1 antitrypsin deficiency. Okay, and that's a blood test. And there are families with this deficiency who have emphysema without smoking. Chronic bronchitis, another part of COPD. It is caused by inhaled irritants, and smoke is an inhaled irritant, causing you to have chronic excessive mucus. When you have mucus of your lower airway, you have obstruction to air, to gas exchange. You have frequent infections. The number one cause of chronic bronchitis is smoking. Another cause is environmental pollutants, and you're going to have a lecture on environmental pollutants next Tuesday. So how do we look at these patients? Well, in COPD, there are two types of patients that have the disease. The pure lung disease person is called a pink puffer. They are thin because they burn a lot of energy breathing, and their blood gases are normal. And they maintain a normal skin color. Blue bloaters, on the other hand, are usually obese. They have a problem with their blood gases. They have heart disease secondary to their lung disease. They are blue. That's why they're called blue bloaters. And that blueness is cyanosis. And that cyanosis is due to hypoxia. So their skin color is blue. The treatment of both these patients is the same. Bronchodilators corticosteroids, and oxygen. And as a last resort, because their lungs are useless, they can have lung volume reduction surgery. And this is basically the pathogenesis of COPD. You can see that the big ones are tobacco smoke and air pollution. This is the genetic cause. These two irritants continue to inflame and irritate the bronchioles, giving you chronic bronchitis and emphysema, which causes airway obstruction, difficulty breathing, and frequent infections. They hypoventilate, their oxygen levels are low, and their carbon dioxide levels are high, giving you respiratory acidosis. We will talk about acid-base balance when we talk about the kidneys. Any questions on COPD? Asthma. Asthma is an obstructive pulmonary disease. However, it is not chronic. It is acute. And there are times when people with asthma are symptom-free. If you have emphysema and chronic bronchitis, you are never symptom-free. But asthma can have periods of symptom-free. It's characterized by coughing, difficulty breathing, wheezing, and chest tightness. The airways are inflamed, and they're usually inflamed by an allergen. And that allergen causes bronchospasm. And when you have bronchospasm, you have constriction of your airways, and that constriction of your airways causes wheezing. It is usually from an immune response. So if you go back to your lymphatic lectures, you'll know that IgE is the immunoglobulin involved in allergic reactions. The airways are thickened with inflammatory exudate, and you get bronchospasm. Tuberculosis. Tuberculosis, thank the Lord, in the United States is a rare disease. It's an infectious disease caused by a bacteria known as Mycobacterium tuberculosis. Its symptoms are fever, night sweats, weight loss, a hacking cough, and sometimes coughing up blood. The treatment is a year's worth of antibiotics. A year's worth of antibiotics. Lung cancer. The leading cause of cancer deaths in North America. 90% of all cases are a result of smoking cigarettes. The three most common types in the order of abundance is adenocarcinoma, squamous cell carcinoma, and small cell carcinoma. You don't have to know where they originate. Just know that there are three most common types: adenocarcinoma number 1, squamous cell carcinoma number 2, and small cell carcinoma number 3. Early detection is the key to survival. If metastasis has not occurred, you need surgery to remove the diseased lung tissue. If you have a metastasis, say to your brain or to your liver or to your bone, then you need radiation and chemotherapy. Sleep apnea, a very common disorder, characterized by a temporary cessation of breathing during sleep. Most people that have it have no idea they have it. It's their spouses or the person that they sleep with that notices that they stop breathing while they're sleeping. It leads to excessive daytime sleeping. You fall asleep at a meeting. You fall asleep at your desk. Obstructive sleep apnea is the most common type. It is caused by a collapse of the upper airway. The pharynx muscles relax during sleep and sag, causing obstruction. You can also have central sleep apnea, which is caused by a reduced drive from the respiratory centers. Alcohol causes this. It also occurs in people with high blood pressure, heart disease, stroke, and diabetes. The treatment of sleep apnea is CPAP, continuous positive airway pressure. It's a device that holds your airway open, preventing collapse. Okay. Any questions on the lung diseases? Time for Jeopardy. Whoop. Gianna, are you here? Lindsay,
I am here.
you have the first question.
Okay.
Air passing from the pharynx to the trachea must pass through the
Trachea and is it the larynx?
yes, the larynx, just the voice. There it is. All right, got it?
Yep.
Ramsha,
Yeah, I'm here.
this structure prevents food from entering the airway.
The epiglottis, D.
You are correct. The epiglottis. Ariana,
Yes, I'm here.
good. The Adam's apple is located on which cartilage?
Thyroid cartilage.
Correct. Thyroid cartilage. Michael, does your microphone work? I'll pass you by. I'll pass you by. Jessica,
Hi.
hello. Which of the following delivers air to the lobes of the lung?
Is it A?
It's actually B. It's actually B. The primary bronchi are the two main bronchi. It's actually B, secondary bronchi. Okay. Joseph,
I'm here.
I know you're here. All of the following are part of the conduction zone, except,
B.
yes, B. B. Very good. Isaiah,
Hello.
hello.
It's good.
Here we go. An increase in the volume of a container filled with air will have what effect on the pressure of the container?
A.
Let me tell you, this is Boyle's law. When the volume increases, what happens to the pressure?
B.
Thank you. Boyle's law states the volume of a gas in a container is inversely proportional to the pressure in that container. Okay, Isaiah?
Okay, I got it.
Good. Erica? Erica's mic might not be working. Maddie?
Hello.
Hello. Surfactant decreases the blank in the alveoli.
Um. I'm not too sure. So, B.
No, it's actually A. Surface
Okay.
tension. Surface tension, okay?
Thank you.
Brianna. Spencer.
Yep.
Here we go. The amount of air that can be forcibly inhaled after a normal tidal volume inspiration is termed the
Is it D?
you say B as in boy?
D.
D. No, because what you're looking at here is volume. You're not looking at capacities. You're not looking at capacities. What's the other answer then?
It'll be
There's only
C.
one other answer.
C.
Yeah, that's the other answer. All right. You're looking at
Yep.
volumes, not capacities. That was a good guess, though. It's a good guess. Linnea.
Hi.
Hello. Which of the following statements is false in regards to inspiration? I should play the Jeopardy music.
Is it C?
When you take in a deep breath, what happens to your thoracic cavity? Does it get bigger?
Yes.
So that's not the right answer, correct? What happens when you take in a deep breath? Is your rib cage elevated?
Yes.
Yes. So now you have two choices. Is the diaphragm relaxed, or is there intrapulmonary pressure has decreased? One of those is the wrong. One of those is a false statement. Which one is false?
D. A.
No, it's B. Your diaphragm contracts and the air comes in. That makes sense?
Yeah.
Okay. Melanie.
Hi, Professor.
Hello. Well, we didn't talk about this, but let's see if you know the answer. Which of the following is responsible for keeping the lungs from collapsing?
Is it a transpulmonary pressure?
Wow, I'm impressed. Very good. That was very good. Patricia. Patricia, I know you're there. Maybe you're not.
She said her mic wasn't working.
Oh, okay. Okay. Oh, no problem. All right. Dwayne.
Yes, I'm here.
Okay, good. Which is not one of the three main factors that influences external respiration?
It would be C.
Yes. Temperature has nothing to do with external respiration. Nothing. Hannah.
Hi.
Hello. The pressure exerted by each type of gas in a gas mixture is the blank of that gas. This is Henry's law, by the way.
Is it partial pressure?
It is partial pressure. Very good. Dennis?
Yeah.
Okay, let's see what we got here. Divers developing the bends is a clinical application of which law? Don't answer it yet. Don't answer it yet. Do you know what gas is involved in the bends?
Oh, not really.
It's nitrogen. It's
Mhm.
nitrogen. The majority of air in the atmosphere is nitrogen.
All right.
Okay? But
Oxygen.
when you're a diver, there is no nitrogen in your oxygen apparatus. Okay?
Yeah.
So the bends, the disease itself is that the nitrogen comes out of your blood and causes multiple problems. So do you know what law this is?
Is it D?
It is D. Okay, very good. Very good. Carly?
Hello.
Hello, Carly. How are you?
I'm good. How are you?
Good. The rate of oxygen diffusion across the respiratory membrane depends upon all of the following except.
I think it's the partial pressure of carbon dioxide in the blood.
I think you're right. Very good. Preet.
I'm here.
Be happy, Preet. Low partial pressure of oxygen and high partial pressure of carbon dioxide in the alveoli will cause
Constriction of pulmonary capillaries and dilation of bronchioles.
excellent. Excellent. Remember what I told you, the lungs work with the vasculature. If there is an area of low oxygen and high carbon dioxide, the pulmonary capillaries will constrict. And to get more oxygen into the lungs, the bronchioles will dilate. Very well done. That's a hard question. Sarah.
Oh.
Hello. Hello. The majority of carbon dioxide is transported.
Is it A?
Oh, no, not at all. It's carbon dioxide, not oxygen.
Yeah. Is it the bicarbonate ions?
Yes, it is. It
Okay,
is.
that was my second.
Yeah, remember the formula. H2O plus CO2 equals H2CO3. The
Yes.
majority of carbon dioxide is transmitted into plasma by carbonate ions. Okay, Emma.
Hello.
Oh, come on. Hello.
Hi.
That's better. That's better. Hemoglobin has the highest affinity for which of the following? I just gave you a lecture on this today. As a matter of fact, the gas in question has a 250 times more affinity for hemoglobin than oxygen.
I don't know.
Carbon monoxide, CO. Okay? Kennedy.
Hello.
Hello, Kennedy. In tissues, hemoglobin will release some oxygen and bind to. Don't answer yet. Remember the formula. H2O plus CO2 equals H2CO3. Now you have a free oxygen molecule. What's it going to bind to? In the formula, H2O.
Hydrogen?
Yes, that's the answer, hydrogen. It makes water. Okay?
Mhm.
That makes sense?
Yes.
Good. Mary Kate,
Hi, Professor.
hello. Oh, we didn't talk about the chloride shift. The chloride shift is that. Don't worry about the chloride shift, Mary Kay. Here's another question for you. Which of the following will increase hemoglobin's affinity for oxygen?
Is it a decrease in the pH?
No, that will, if you have a decrease in the pH, that means that your tissues need oxygen, so it will get rid of oxygen. Okay? Does that make sense?
Yeah.
Okay. Let's go over this. If you have a decrease in pH, it means you're acidotic and your tissues need oxygen. What about if you have an increase in your partial pressure of carbon dioxide? If you have an increase in partial pressure in carbon dioxide, you have, as we showed, you have a respiratory acidosis and you need more oxygen. So that's not the answer. Okay? What about if your temperature is 104? Does your tissue need more oxygen if your temperature is 104? Mary Kate?
Yes.
Yes. So the answer is D, the presence of some oxygen already bound to the hemoglobin. That's a horrible question. Never in my life would I ever ask a question like that. Nicole.
Hi.
Hello. Ooh, there's another hard question too. Which respiratory control center is not located in the medulla?
I'm gonna guess D.
D? What the hell is D?
I don't know.
Sounds like a car, doesn't it?
It reminds me of Law and Order SUV.
It's a car. Special Victims Unit, huh?
Yeah.
What does the P stand for? You know what the P stands for right here? What area of the brain begins with a P?
Pons.
There you go. Is the pons in the medulla?
Yeah.
Say no.
No. No, they're by each other though, right?
Right. It's the pons. Okay, PRG, the pons respiratory group. All right. Gianna.
Hello.
Hello. A decrease in pH will have what effect on the respiratory rate? The question is, what does acidosis have to do with your respiratory rate? Your pH has dropped from 7.4 to 7.10. Are you breathing faster or slower?
Faster, there's an increase.
Yes, faster, faster. Everybody understand that? Let me go into this a little bit more. What acid, anybody, what, no, not anybody, Anthony.
Hey, Professor.
Hey, Anthony, tell me what acid does the lungs expel? You can say, I don't know.
Yeah, I'm not sure.
Okay, let me give you the formula again. Finish the formula for me, okay? H2O plus CO2 equals write it down. H2O plus CO2 equals,
H2CO3.
and what acid is that? That acid is carbonic acid. Do the lungs expel water?
No.
Oh, come on. Yes, they. What if it's cold outside and you breathe? What are you looking at?
Yeah, that's water.
That's water, is it not?
Yeah.
Does the lungs expel carbon dioxide?
Yes.
So H2O plus CO2 is carbonic acid. Does the lungs expel carbonic acid?
Yes.
Yes. And you will learn, all of you will learn, that the respiratory system is the fastest way to get rid of acid by breathing fast. Okay? The other system that gets rid of acid is the urinary system. And the respiratory system and the urinary system act together to maintain your blood pH. And we'll talk a hell of a lot more about that when we go into the urinary system. Okay? Does everybody understand that? Am I confusing anybody? Good. Melissa. Lindsay. Now they don't want to answer me. Lindsay. Ramsha.
Yes.
Good. You're up. The inflation reflex depends on stimulation of what type of receptor. Don't answer it. We didn't go over it. The answer is mechanoreceptors. Here's another question for you. Ooh. Oh, this is actually not bad. Apneustic breathing occurs as a result of damage in which respiratory center? I would never ask this question.
The damage, would it be dorsal?
No, it's actually the pons, so it's pontine. But I would never ask that question. Don't worry about it. Don't worry about it.
Professor, real quick.
Yo, go.
That pond, right? That's not the same one that was the answer a couple answers ago. That was next to the medulla.
Yeah, it is.
Okay, so
same answer.
Apneustic breathing occurs as a result of damage to. So when you, I guess, the damage to your brain can affect your
breathing. Let's go over both centers. In the medulla, you have the dorsal respiratory group and the ventral respiratory group, the DRG and the VRG. Both those areas are with normal breathing. The rate and depth of respiration is controlled by the pons. So if you have a pontine hemorrhage, your breathing will be called apneustic breathing because you will be breathing unorthodoxly. You will be taking huge deep breaths and blowing out very little. It's not normal breathing. Normal breathing is controlled by the medulla. The depth and rate of breathing is controlled by the pons. Does everybody understand that?
Yeah.
Okay, we good?
Yeah. So any damage that I guess occurs would kind of like I guess shut off the medulla in terms of it having like control of the breathing, and it'll just transfer over to the pons.
Yes. Yeah. Yeah.
Okay.
All right, you got it?
Yeah. Thank you.
Joe,
Yep.
which of the following has the greatest effect on respiratory rate?
PCO2.
Yes. Yes. That is the answer. The partial pressure of carbon dioxide. Very important. This is why you cannot hold your breath and die. You hold your breath. What happens to the partial pressure of carbon dioxide? Does it go up or down?
It goes up.
Goes up. It goes up. Once you get a high partial pressure of carbon dioxide, your brain says, breathe. And you either pass out and breathe or you just breathe. So you cannot hold your breath and die. It's not feasible. It can't be done. Cannot be done. All right, you got it? Isaiah.
Yes, hello.
All right, last question. Here it is. When holding your breath for a long time, we get the urge to breathe because of
Is it C?
boom. Okay? Everybody understand what we're talking about here? I'm going to stop recording.